Hello, and welcome to our third summer school. My name is Hilda Hayo, and I'm the Chief Admiral Nurse and CEO of Dementia UK. I'm going to tell you a little bit about the origins of the charity, about Admiral Nurses and what we do, and also tell you a little bit about the strategy that we've got for 2020 to 2025. So it all started in the 1980s, when a family had one of their members diagnosed with vascular dementia. The gentleman's name was Joseph Levy. His family felt that although he received really good care and support, as a family they didn't feel as supported. So they decided to have a specialist nurse that would look after the needs of the whole family. They weren't really that sure about what to call those nurses. And because Joseph Levy, nickname, was Admiral Joe, the family decided, let's call these specialist nurses Admiral Nurses. So Admiral Nurses first came about in 1990, and the first few Admiral Nurses were only based in London. Then over the next 4 to 5 years, as these posts started to develop, it was decided by their family that they would set up a charity to enable them to be able to support families living with dementia through Admiral Nurses and through education and training. So in 1995, the charity was set up, so a full 5 years after the first Admiral Nurses. Now, the charity that they set up has had several names over the time, but in 2010, it was decided to call the charity Dementia UK. So Dementia UK, the USP that was set up to provide was the specialist dementia nurses, called Admiral Nurses. So what do Admiral Nurses do? Well, we're specialist dementia nurses. We were set up to support the whole family. And in particular, we specialise in providing emotional and psychological support. With dementia, some complex issues can arise. For instance, the need for long-term care when the family can no longer cope, or the person that's living with a diagnosis realises that they need to go into longer-term care to enable them to have their needs met. It could be some of the changes that can occur in dementia with the personality, the behaviour, the way they get on with other people, and the need for ever-increasing physical support. So Admiral Nurses specialise in providing all of this support to families living with dementia. We also specialise in giving best practice advice to other health and social care professionals, whether that's on our helpline, in our clinics, or in the services that are hosted in local communities. So where can you find Admiral Nurses? We have 431 Admiral Nurses currently, and they're dotted about across the UK. These are what are called hosted services, so they're set up in order to meet the needs of local communities. And they can be provided in the community, in acute hospitals, in care home settings, in hospices, well, anywhere really where there's people and families living with dementia. Some services from the charity, and that is the Admiral Nurse Dementia Helpline and the Admiral Nurse Clinics, and also our consultant Admiral Nurses. Our Admiral Nurse Helpline functions at 7 days a week, and we have nurses that are on the calls and will take live calls, or will listen to the triage calls or the emails that we get sent. And we have approximately 35,000 calls and emails per year. In addition to that, we also have Admiral Nurse Clinics. At the moment, that's a 5-day-a-week service where people can be seen either via video, or they can send a kind of a phone call request, so we can actually communicate with people within the clinics. And the clinics will provide the same sort of support as the Admiral Nurse Helpline and also the local Admiral nurses. So we'll give very specific, individualised advice and support to those families that need it. In addition to that, we have the consultant Admiral nurses. Now, the consultant Admiral nurses are covering a range of topics that are a little bit more specialist with providing advice and support for families living with those conditions. So we have consultant Admiral nurse for Lewy body dementia, for young onset dementia, and also for frailty. So those Admiral nurses will work with families that have been referred through the helpline or clinics and give that extra bit of one-to-one advice and support that that family may well need at that time. So with Admiral nurses, just to recap, we support the whole family, whether that's the person with the diagnosis or the person that's actually living with the effects of dementia. And for some people, it's not family as we would understand family. It could be that they're living in longer term accommodation, and so therefore we were supporting the people around and supporting that person. It could be the neighbours, the local neighbours, that are supporting the person that's living with dementia. And of course, as I said before, it is giving best practice advice to other health and social care professionals who may need a little bit of extra support in dealing with some of the complexities of dementia that they see. So we have got a strategy, a 5-year strategy that started in 2020. So the strategy will go from 2020 to 2025. And the key aims of this strategy are to increase the numbers of Admiral nurses, both in our delivered services within the charity, but also in our hosted services. As I said before, we've got 431 nurses at the moment, and that number is ever growing. And by the end of 2025, we aim to have 500 Admiral nurses. We're way on target for that. We like to reach hard-to-reach communities. So the hard-to-reach communities that we're focused on are some of the diverse communities that we will meet in our culture. We also look at young onset dementia and focus our support on people living with young onset dementia. We have our first Chinese Welfare Trust Admiral nurse who focuses on the Chinese community in the London area. And these sorts of posts we aim to grow further throughout the UK so that we deal with the diverse needs of all different communities that make up the UK. What we also do is provide evidence of the effectiveness of Admiral nursing. So we do that by writing articles, by doing audits, by doing evaluations, and by writing books and making sure that we actually talk about the benefits of Admiral nursing and the benefits of giving best practice dementia care support. The growing number of Admiral nurses also need support. And we support our Admiral nurses through the Academy. So we've got an Admiral Nurse Academy that we are currently providing internally, but the plans for the future would be to roll that out so that people that are external to the charity can actually access that. So the Academy gives education, training, support, practice development for Admiral nurses and makes sure that they are always the best quality nurses you could possibly have, specialising in dementia care. On top of that, we have monies coming into the charity that we want to reinvest in making sure we can grow the numbers of Admiral nurses to support our beneficiaries. So we have what's called Pump Prime monies. So for some services or some areas where we want to get into, we will provide half funding for those nurses to enable them to be able to grow a team within local areas. So generally we half fund for around 2 years. We have 52 nurses that are actually supported by that at the current time. We also want to be more influential around campaigning, public affairs, and making sure that people are aware of what it is that we do as specialist nurses. So this is kind of a fledgling area that we've started in the last year, and we aim to develop that for the future. We also aim to increase the public awareness of what Admiral nurses are and what Dementia UK can actually offer to families living with dementia. And we've had a couple of campaigns now, and we aim to increase those over the coming years. So what do we plan to do after 2025? We aim to have, by the time we get to 2030, 1,000 Admiral nurses. This will enable us to meet the needs locally of those families that need the support of a specialist dementia nurse. So we will continue to develop the number of posts. We will continue to develop the support available to those nurses to enable them to be at the best they possibly can be at specialist dementia care. So thank you very much for listening, and I hope you enjoy the summer school. Certainly the last 2 summer schools have been absolutely fantastic, so I'm hoping this one will be too. And if ever you want to ask about Dementia UK or Admiral Nursing, I'm sure you will have details throughout the summer school of who to contact. So thank you very much, and goodbye.